Welcome to Ultra Dental. My name is Olga Osipov, and I'm directing marketing at Ultra Dental. And today with me is Nancy, our office manager, who knows very much about Denti-Cal and other insurances, and lots of she can provide you lots of information about dental information, dental insurances. We are a practice is pretty young, with young doctors, but very experienced. We are very well equipped and specialize in general dentistry, pediatric dentistry, orthodontics, and implants at the same time. So we always welcome new patients, and we appreciate our loyal patients. And definitely would like to see you stop by at our office and talk to our staff, take a tour. Our doctors are Jan Yampolsky, Yuri Gershfeld, Steven Spivak, and Dalia Nasrati. They all specialize in different, and they're very strong in different areas, and definitely would be able to provide you with answers to your questions. If you have any issues, please share them with us. We also provide dental education. Today's webinar is more about education rather than selling any services. We would like to have our patient be educated and make educated decisions about their healthcare. So that's why it's really important that you've joined us today. Nancy now will tell us more about Denti-Cal and what we need to know and how to take advantage of it. Nancy?
Good afternoon, everyone. My name is Nancy, as Olga has mentioned to you. The reason of this webinar is in regards to the Denti-Cal benefits that they have been researched for the adults. Before 2018, a lot of the benefits were cut off, and those included a lot of root canals in posterior teeth, partials, and periodontal treatment, which is very essential. Now, most of the benefits they are restored by Medi-Cal will have disadvantages and advantages. The advantage is that they are at no cost to you. The disadvantage is that we all know that the materials that Medi-Cal applies are not their standard and their quality, which it's a temporary solution, but it's not a long-term solution for your dental needs. Now, we are here equipped to provide you with the proper diagnosis, and we'll give you all the options available to you. And we can apply or maximize your dental coverage to supplement your needs. Now, we have learned in the past that by using these standard materials, they have a short-term life. There are also differences in the material. One of the things that they're covered right now are root canals, which are covered for posterior teeth. Once the root canal is completed, you will need a crown on that to protect it from breakage or fracturing. Medi-Cal will cover a substandard crown. Laboratory processed crown are covered in certain conditions. Now, again, to find out whether you qualify for the service or not, you need to come in. We need to do a complete examination. Now, if you are thinking of a long-term solution for your condition and something that will be healthy and long-lasting, the best procedure would be a porcelain crown. In regards to dentures, dentures are also covered now. Before, they only covered full dentures, whether upper or lowers. Now they are covering partials as well. And within partials, there's also a difference. There are those that they're resin based, and there are those that they're metal based. Now, what is the difference, you would ask? Well, the resin based, which are covered by Denti-Cal, are very flimsy. And also they have a little hook on each side, which means that it could crack, it could break, but the metal partials are very solid and will last you a long, long time. We're looking at probably 15 to 20 years. The solutions, again, there's a danger. It all depends what is it that you need, what are your goals, um, and we can help you in all of that. There is, like I said, temporary solutions, which you can maximize your Denti-Cal program, or you can go and upgrade and use Denti-Cal as a supplemental to your needs. Again, your medical necessary needs will be covered.
Nancy, what do you think in terms of, just give us an example. For example, if you take a denture, I mean, there are probably dentures that are covered by Denti-Cal and insurance. So what's the difference even in managing them? Not just the quality of material, but, for example, adjustment.
Adjustments. Okay. Usually with the stay plates or the ones covered by Medi-Cal, they are, again, very flimsy. There needs a lot of adjustments. Most people are not really happy with them because the fit is not proper, or they don't feel like they're solid enough. Whether with the high option one, which is the metal partial, you do have stability and you do have the possibility, keeping them for a long, long time.
So what would be the best way to use Denti-Cal so they can take advantage of the new services covered and actually have a quality material in their mouth so they are sure that it's not going to fall out in 2 years?
Well, the advantage would be is that use use the Medi-Cal coverage as a supplemental to your dental need. In other words, maximize dental coverage, your Denti-Cal dental coverage, which we can help you with. Based on the examination, once the doctor determines what are your base needs, we will maximize your Medi-Cal coverage and then use it as supplemental for anything that we need in addition to.
Okay, sounds great. So I think that gives us an idea of how you can manage all the available services. By the way, Nancy, can you tell us which services have been added?
Sure. Basically, on medical patients, which this is the most important one because everybody is in need of periodontal treatment, which are deep cleanings. Deep cleanings have been added for adults. Before 2018, it was a coverage that it was not a cover benefit. And the only item they would cover for adults were just regular cleanings, which did not address the problem that we have with periodontal disease. Now, under this new addition or this new restoration of adult services, deep cleaning are a cover benefit based on authorization. Now, it's not something you come in and do right away at the office. You do come in, we do an exam, we submit the proper authorization to Denti-Cal, and in turn, they go ahead and send us back the authorization to do the treatment. But this is a very important procedure. Mostly everybody, our gums are the base of our dental, of our teeth, and we need to have healthy gums, strong gums, in order to support our teeth.
Mm-hmm. Nancy, what about children? It seems like they didn't have any change in their coverage.
Under 21, the benefits remain the same, in which children's benefits root canals were covered. The only item that, still the same for children under the age of 13, processed porcelain crowns are not covered. You have to be over 13 to process for crowns.
Mm-hmm. Okay, all right. So that's good. So just to give us an overview, so how do we need to take advantage of our Denti-Cal, and what should we be careful about, and what would be the best combination of Denti-Cal and other services not covered?
For every person, individual person, everybody has different needs. My suggestion and my experience, you need to come into the office. You need to have a full examination. Have the doctor present you or diagnose exactly what you need. Based on your personal need is what we can determine what to submit to Medi-Cal, what it would be covered. But
Okay.
it has to be as an individual.
Okay, very good. And I
And
think just speaking about that, we always welcome new patients. You don't have to be with us, or I mean, you can actually be with other practice, but you can take advantage of our welcome package. For kids, we're offering free happy cleaning, and they can even get a surprise present. You can get a gift card and also a discount. We also welcome families, and we offer a joint kind of a group discount for depending on their services and their needs. And definitely, we're going to work with you on co-payments. So, Nancy,
yeah, definitely. And like I said, you may have your own dentist at this moment, but if you have any questions, you have any doubts, or if you need a second opinion, we are here at any time. Give us a call. Come in. We'll explain to you what you need. And again, if you do have Medi-Cal, you're more than welcome to come in, get a complete examination, regardless if you are being seen somewhere else. But if you have any questions, at least we'll be able to answer them.
yeah, we also, once you become our patient, we offer rewards for loyalty. If you refer any of your friends or family to us, we definitely will reward them. Again, now it's Amazon gift card, but maybe later it'll be even something else. And we offer also credits, so for different services. That's why we would love to become part of our family and take advantage of our talented doctors and staff who will take care of you very well. So, and now it's time for a raffle. We decided that we will just pick three different people who signed up today and are present right now at this webinar, and we will uh, uh, inform them about what they won and send them a note, probably via Facebook or other information if we have it, email or maybe text, so they can stop by and pick up their present. So that's why we will continue doing some webinars and inform you about different uh, insurance or maybe services that will be available or our office will be providing. So that's why please call us, stop by, and let us know what bothers you. We'll definitely help you.
Oh, and another thing, Olga, this March 31st, there's going to be in San Fernando a street festival. In our office, we're going to have a booth outside, and everybody's welcome to stop by. We're going to have some gifts, and just get to know us. The staff will be present, and so introduce yourself and get to know us. And if you have any questions, stop by, please.
Yeah, and it's so convenient. We will have our booth right next to our door because the street fest
Exactly.
will be going right through, through the street that we're on. So that's why it will be very convenient. You could just, hop right in, and we will help you. We will be giving away some coupons for new patients, and also another thing, if you happen to see our giveaway offer on Facebook, definitely take advantage of it. We have lots of free gifts, and there'll be no one who would lose. Everybody will get
There's
some.
still time to sign in because
Yeah,
our drawing is not going to be until April, right?
yes. Like the first week of April, we will announce a winner who will actually win a dress. And even if you don't need a dress, you can still submit your entry and give it to somebody else who know might need it. There's also a nice present, the tuxedo and desserts, and also many other prizes. So definitely take a look at our page on Facebook and go to our website. We have just launched our new website, which is ultradental818.com. And we will welcome you there with some new offers too. So look forward to hearing from you, and have a great day.
Thank you very much for joining us.